I took my first trip to Epic in Verona, Wisconsin a few weeks ago. It was as fun and over the top as everyone said it is. The users group meeting featured announcements about new AI products coming out, presentations about the way organizations around the world are implementing different elements of Epic or using Epic to improve care delivery and even research. Buses shuttled us from our hotels that were sometimes up to 90 minutes away from the Epic campus, where every building has a theme, including Oz, Deep Space, Wizards Academy. I met up with the CMIO from Melbourne who gave a talk and also spent time with colleagues from UT Southwestern. This wasn't my first time in this part of Wisconsin. I moved there in 1992, where I was admitted to a PhD program in Chinese literature. I didn't leave with a PhD, but I did leave with my first baby. The trip to Madison got me thinking about electronic health records, which are close to home, since one of the first was built by the chair of the department I graduated from. Homer Warner published a paper applying Bayes' theorem to diagnose congenital heart disease. Homer went on to build a lot of different systems to collect and display data to help with patient care. One day he saw a nurse struggling with the blood pressure display in the ICU that he had developed. It was a turning point for him because he realized that she was overwhelmed with data, and the data was not enough. The clinician needed guidance about what the data means. The system needed intelligence. That's how the HELP system got started. HELP was designed to make data available to physicians so they could see the current data about the patient. But HELP also had a knowledge base, the logic for making decisions from the data that was personalized based on that patient. HELP relied on an electronic medical record of patient data, but by explicitly stating the logical requirements for making decisions based on the data, HELP specified the required contents of the medical record. What does it mean to have an EHR? There are mixed feelings about electronic medical record systems. About half of those surveyed think that the EHR improves workflow. 70% think the EHR substantially contributes to stress on the job, though, and they don't agree that it improves job satisfaction. However, 65% are satisfied with the EHR. But having to wait for the next released module that Epic provides doesn't imbue a feeling of autonomy. That's why when I was the chair of biomedical informatics at the University of Utah, we started an initiative called Reimagine EHR. Reimagine EHR asks, what if it was a joy to use the EHR? What if it saved you time and it made it easy to do the right thing every time? What if you could control the way it works for you? When Ken Kawamoto piloted a co-designed neonatal bilirubin management application that was embedded into the EHR, he received the first standing ovation of his career from the neonatologists. They were able together to develop an application that pulled data from across the EHR about the mother and the baby, compare it to existing guidelines, and provide actionable decision support driven by the physicians. It was a game changer. This is not an application Epic planned to develop. It's too small of a market. But it was a life changer for the neonatologists. Reimagine EHR uses standards like SMART and FHIR to seamlessly embed the application into Epic. Building applications with FHIR is much more time-consuming, though, than just building something into Epic. At UT Southwestern, we have the ability to develop some pretty amazing things using Epic Enterprise tools. Mujib told me that people are constantly shocked at what can be done within Epic. This is Grant, and he took me on a personal tour of many of the buildings. He's a technical specialist assigned to us, and expertise that he brings, along with others on the team, enable more innovative development in Dallas. There are many ways to approach innovation with modern EHRs. The Utah team described the need to balance functionality with portability. If you design something that's amazing and really useful, to truly have impact in the world, it needs to be disseminated beyond your own organization. And writing a paper isn't the way to get impact. You need software that integrates into another organization's EHR, that fits into their workflows, and demonstrates that it provides good outcomes. I'm realizing, as I continue to meet with people across campus, that just like everyone has a different opinion about EHRs, everyone has different ideas about what informatics is. Just like we have different ideas about what a bird looks like. This is an emu in the wild in Flinders Ranges in South Australia. So next week, I'll talk about health informatics. Gorm would love to encounter an emu, but he wasn't going to find one in the Rio Grande in Albuquerque. Still, he was happy to splash around in the muddy water.